Your support means in 10 years we will have become a healthy, connected and compassionate region.
And in this, all people will have an opportunity to contribute to a resilient community. This will look like sustainable and effective community partnerships so that silos of care are avoided.
We will have educated and engaged residents with a positive relationship with their mental health.
And we'll have easily accessible and strategic support services so that people are not under-serviced because of their mental health.
And we will have a positive family relationship without violence and trauma.
We have such strength across our community through volunteers, through our community groups and community members. We've got strong grassroots, and together with a little bit of support, we can do big things for our community. I think initially we've proven that as a community that we're motivated and activated. We've got a series of evidence-based initiatives which have shown this throughout the community over the previous few years. So just a couple of years ago we had 4 male suicides in one township over just a short period of time. Our community rallied together to show support and to create a series of initiatives to really help, I guess, combat mental health. So a series of things such as local men's sheds were created to help men not feel so isolated in our rural community. There were also a suicide prevention network that was set up in order to address, I guess, the vulnerability that's in our community as well. We have recently, over the last probably 5 years, created a strong partnership across the community called Mid-Murray Family Connection. So it's all about people working together to solve one simple issue, and that for us was childhood development. So 1 in 3 children were developmentally vulnerable, and through a series of initiatives such as our Mid-Murray Mums Facebook page, which is connecting families to share resources and skills and knowledge. That's created about 250 people, and initially we had 1 in 3 children vulnerable, and those statistics have improved to 1 in 5, which has been great as well. So I think that we've got strength in numbers across our community, and with that bit of help, that's all we need.
Given our base of strength, we intend to mobilise this community of really motivated individuals to learn and grow in a number of ways. The first is that the group that met today of energised and motivated community people really needs to meet again. We need to come together, design a common language and have a plan about how we're going to mobilise the rest of the community. After we've met and we understand our purpose and our expectations, the plan is to take these tools in our pockets to community groups. We want to connect with a range of those across the region: senior citizens, RSL, Lions Club, sporting groups, scouting and other interest groups, schools in particular, and churches. With our hearts and our hands, we want to offer them 2 opportunities for their committee members, for coaches and for instructors. So the first one is that we will train them and upskill them in the social and emotional learning skills that young people need so that they're empowered to make a big difference to young people's lives. We also want to offer mental health first aid training so that they can respond in times of crisis. We'll ask community groups to commit to action in these and make a concerted effort to deliver that over the next 10 months. Our third intention is to activate young people in the process through conversations with schools, youth and church groups. What is it that young people need, and how can we support them to achieve those outcomes? We need to give them an authentic voice in their own futures.